You have been trying to get rid of them for years. Those small, soft growths on your neck, your armpits, your eyelids. You have tried the thread method you found online. You have considered cutting them off yourself. You have spent money on creams and oils that promised results within weeks. And here is what nobody told you. Most of what you have been doing has either not worked or made things worse. And more importantly, those growths are not the problem. They are a message. A specific, readable message from your metabolism that most people and most physicians in a 15-minute appointment never actually decode. Today, I am going to show you how to tell the difference between the two main types of skin growths people confuse constantly, what the more common one is actually telling you about your internal health, why 3 of the most popular home remedies are genuinely dangerous, and the correct protocol for both types that starts tonight. Stay with me because the metabolic connection I am going to describe in the middle of this video is the one that changes everything. It explains why people keep getting new ones after removing the old ones and what actually stops that cycle. I'm Dr. Jake Taylor. Write your country in the comments right now, and if you are new here, subscribe and turn on notifications. I make these videos every week for people over 60 who want practical health information they can use starting tonight. Let me tell you about Helen. She was 67 and had been dealing with skin tags on her neck and armpits for about 8 years. She was embarrassed by them. She had tried the thread method twice and ended up with a small infection both times that required antibiotic treatment. She came to my practice not to talk about the skin tag specifically, but because her energy had been declining for 2 years and her physician had told her everything looked normal on her blood panel. When I reviewed her full history and examined her, the pattern of skin tags combined with her other symptoms told me something her standard blood work had not captured. Her insulin had never been tested. When it was, her levels were significantly elevated despite glucose that still looked acceptable. She had insulin resistance that had been developing for years, producing both her energy decline and her skin tags simultaneously, and nobody had connected them. We addressed the insulin resistance directly through dietary changes and structured movement. Her new skin tags stopped appearing within 4 months. The ones already present began to shrink. Her energy returned measurably within 8 weeks. She said something I have heard in similar words from many patients since. I thought I had a skin problem. I did not know I had a metabolism problem. Today, I am going to make sure you understand the difference and what to do about both. Here is the single concept that makes everything that follows make sense. Your skin is not just a surface. It is a reporting system. Different types of abnormal skin growths reflect different underlying conditions. Understanding which type you have tells you which problem you are actually dealing with. Treating the growth without understanding the message it is sending is like silencing a fire alarm without looking for the fire. You address the symptom, the cause continues. This is why so many people successfully remove skin tags only to watch new ones appear in the same areas within a year. They removed the alarm. They did not address what triggered it. Now let me walk you through how to tell the two main types apart, because this distinction determines everything about what you do next. The first type is a true wart. Warts are caused by specific strains of human papillomavirus, HPV. There are over 200 strains of HPV, and the vast majority cause only these benign skin lesions. The virus enters through microscopic breaks in the skin surface and instructs your cells to multiply abnormally. That uncontrolled multiplication is the growth itself. How to recognize a true wart? It is firm. It has a rough, irregular surface, sometimes described as resembling a small cauliflower. If you look closely at a common wart, you may see tiny black dots within the lesion. These are not roots, as many people believe. They are small clotted blood vessels. Warts typically appear on the hands, fingers, knees, and the soles of the feet. They are hard at the base and do not move when you push them. And critically, warts are contagious. They can spread to other areas of your own body and to other people through direct skin contact or shared surfaces like shower floors and towels. The second type, and the one that affects a significantly larger proportion of people over 50, is the skin tag, also called an acrocordon. Skin tags are not caused by a virus. They are not contagious. You did not catch them from anyone, and you cannot give them to anyone. A skin tag is a small benign overgrowth of your own skin tissue made of collagen fibers and small blood vessels enclosed in a layer of skin. How to recognize a skin tag? It is soft. It moves when you touch it. It hangs from the skin on a narrow stalk, like a small sac. Its color is usually similar to your surrounding skin, sometimes slightly darker. Skin tags appear almost exclusively in areas of friction: the neck, armpits, groin, under the breasts, and on the eyelids. They are not hard. They do not have the rough cauliflower surface of warts, and they do not contain those tiny black dots. There is a third type worth knowing about because it causes significant confusion. Seborrheic keratoses, sometimes called age spots or age warts, are neither warts nor skin tags. They are rough, waxy-looking growths that appear stuck onto the skin surface rather than growing from it. They are typically brown or black, sometimes with a slightly greasy appearance. They are completely benign and common after 50. They do not require treatment unless they become irritated. If you have a growth with these characteristics, it fits in this third category and requires neither the thread method nor the salicylic acid protocol. If any growth, including one that looks like a seborrheic keratosis, has multiple colors, bleeds spontaneously, or has changed recently, that warrants a dermatology appointment regardless of which category it appears to fit. So if the growth is on your neck or armpit, soft, hangs from a stalk, and moves when you touch it, you almost certainly have a skin tag. If it is on your hands or feet, hard, rough-surfaced, and fixed firmly at its base, you almost certainly have a wart. This distinction is not a formality. The correct identification determines everything about what follows, because treating a skin tag as though it were a wart is not just ineffective. It can cause real harm. Before I go further, I want to stop for a moment. If this is already clarifying something you have been confused about for a long time, subscribe right now. We publish every week specifically for people over 60 who deserve direct, practical information rather than the vague reassurances that come out of a rushed appointment. 3 seconds, subscribe, and let's continue. Now, the home remedies that you should never use. I want to be direct with you about 3 methods that are widely circulated online and that, from a clinical standpoint, concern me significantly. The thread method. The logic sounds simple. Tie off the blood supply, let the skin tag die and fall off. The reality in a non-sterile home environment is very different. You are creating a wound in living tissue. The thread, your hands, the skin surrounding the tag, none of this is sterile. Bacteria can enter and cause cellulitis, a skin infection that produces redness, swelling, pain, and heat that frequently requires antibiotic treatment. I have seen patients arrive at my practice with inflamed necks from a piece of thread left too long. The second risk is scarring. If the tag is moderately sized, it does not simply fall off cleanly. The necrosis that occurs is not a precise process, and the resulting wound frequently heals with a scar more noticeable than the original growth. The third and most significant risk applies to anyone who is not completely certain of what they are treating. Some forms of skin cancer can resemble a benign skin tag or wart in their early stages. If you remove a lesion at home, you lose the opportunity for a physician to examine it. You could be eliminating what was actually an important diagnostic signal. Dorothy was 69 and had used the thread method on a growth on the side of her neck. The tag came off after 4 days. 2 days later, the surrounding skin was red, warm, and beginning to swell. By day 3, she had a fever, and the redness had spread several centimeters from the original site. She required oral antibiotics and returned twice for follow-up. The site healed with a scar significantly more prominent than the skin tag had been. She told me, "I spent 4 years being self-conscious about a small tag. Now I have a visible scar in the same place. The cure was worse than the problem. Cutting with scissors or a blade. Every risk of the thread method applies here, amplified. The bleeding risk is significantly higher. The infection risk is equivalent. A kitchen scissors or nail clippers sanitized with alcohol are not surgically sterile, regardless of how long you soak them. I have seen patients arrive in emergency settings after attempting this, with bleeding that would not stop, pain that was far beyond what they anticipated, and infections requiring intensive treatment. The outcome was scarring that was dramatically worse than the original growth. Applying acid at home. Apple cider vinegar, lemon juice, and various other acidic preparations are frequently recommended online for wart and skin tag removal. The fundamental problem is that acids cannot selectively target abnormal skin tissue. They chemically burn everything they contact, including the healthy skin surrounding the lesion. The result is a chemical burn that creates irritation, discoloration, and scar tissue. For a wart on the heel, this is a painful setback. For a skin tag near the eye, the risks escalate considerably. Let me tell you about Robert. He was 73 and had been treating a cluster of skin tags on his neck with apple cider vinegar for 6 weeks before coming to see me. The skin tags had not changed meaningfully. The skin around them was raw, discolored, and beginning to show the texture changes that indicate early chemical burn scarring. He had created a problem significantly worse than the one he started with. He told me he had assumed that because it was a natural remedy, it could not cause real harm. Natural and harmless are not synonyms. Chemistry does not consult your intentions before it reacts. The correct approaches for both types, starting with what matters most. For skin tags, the most important intervention is not removal of the existing ones. It is understanding and addressing why they are forming. This is the piece most people never receive. Skin tags are strongly associated with insulin resistance. Insulin is the hormone that acts as a key, allowing glucose to enter your cells for energy. When you consume large amounts of refined sugars and processed carbohydrates over years, your cells can become progressively less responsive to insulin's signal. The pancreas compensates by producing more insulin, creating chronically elevated levels in the bloodstream. Insulin is also a growth-promoting hormone. Those elevated levels can signal skin cells to proliferate abnormally, forming skin tags. This is why skin tags are significantly more common in people with excess weight, metabolic syndrome, and type 2 diabetes. Estimates suggest that up to 46% of adults develop skin tags, and the incidence increases substantially with insulin resistance. This is the message your skin is sending. Not a cosmetic problem. A metabolic signal. George was 71 and had developed clusters of skin tags across his neck and both armpits over about 6 years. He had removed them twice with dermatological procedures, paying for each treatment himself. Within a year both times, new ones appeared in the same areas. He was frustrated. He felt like he was managing a problem that kept returning rather than solving it. When I reviewed his metabolic history, his fasting insulin had never been tested despite a family history of diabetes and a gradual weight increase over the same 6-year period. His insulin came back at twice the upper limit of normal range. His fasting glucose was 98, technically normal. His standard blood panel had never flagged a problem, but his insulin was telling a completely different story. We addressed the insulin resistance directly. 3 months later at his follow-up, he had developed no new skin tags. 6 months later, some of the smaller existing ones had noticeably reduced. He told me, "Nobody ever connected the skin tags to anything inside my body. I thought they were just something that happened to some people." He is right that they happen to some people. The question worth asking is why they are happening to you. The practical implication is significant. If you remove skin tags without addressing the underlying insulin resistance, you will continue developing new ones. The trigger is still active. You are removing the alarm without addressing the fire. The dietary changes that reduce insulin resistance and slow or stop new skin tag formation. Eliminate refined sugars and processed carbohydrates as a primary intervention. White bread, pastry, sweetened beverages, white rice, packaged snack foods. These are the primary drivers of the insulin elevation that promotes skin tag formation. Increase fiber from vegetables, legumes, and whole grains. Fiber slows glucose absorption and blunts the post-meal insulin response. Move consistently. Muscle contraction during exercise improves cellular insulin sensitivity independently of diet. 30 minutes of walking daily produces measurable effects on insulin resistance over weeks. Manage sleep. This is the connection that surprises most people. Chronic sleep deprivation of even 1 to 2 hours per night significantly worsens insulin resistance. Growth hormone, which is released primarily during deep sleep, plays a direct role in maintaining insulin sensitivity. If you are sleeping less than 7 hours consistently, no dietary change will fully compensate for what the sleep deficit is doing to your metabolic hormones. Reduce chronic stress. Cortisol, the stress hormone, directly raises blood glucose and promotes insulin resistance. The combination of elevated cortisol and elevated insulin creates a hormonal environment that is highly favorable to skin tag formation. Stress management is not a soft recommendation. It is a metabolic intervention. William was 68 and had made significant dietary changes after our conversation about insulin resistance, but was not seeing the metabolic improvement his numbers should have reflected. When I asked about his sleep, he described consistent 5 to 6 hours per night due to early work commitments that he had maintained for years. His cortisol pattern was also elevated from a period of sustained professional stress. We addressed the sleep first as the highest priority intervention. At his 3-month follow-up, his fasting insulin had dropped by 1/3 without any additional dietary changes beyond what he had already made. The sleep had been the limiting factor the entire time. He said, "I was doing everything you told me about food, and it was not moving. I did not realize I was undoing it every night. These changes will not cause the skin tags you already have to fall off overnight. What they will do is stop new ones forming and, over months of consistency, reduce the hormonal environment that drives their growth. Some existing tags do reduce in size as insulin resistance improves. Results vary by individual. For skin tags that are already present and causing cosmetic or physical discomfort, the safest and most effective approach is a brief dermatological procedure. Cryotherapy, cauterization, or simple excision by a trained professional takes minutes and produces clean results without the infection and scarring risks of home methods. If cost or access is a barrier, this is worth discussing with your physician, as some insurance plans cover removal when tags are symptomatic. For warts, the evidence-based home approach uses salicylic acid at low concentration, available without prescription in pharmacies as a liquid, gel, or adhesive patch. Salicylic acid works by gradually dissolving the outer layers of the wart. The process is slow, typically requiring weeks to months of consistent nightly application, but it is the only over-the-counter method with meaningful evidence behind it. The correct protocol: each evening, soak the area in warm water for 5 to 10 minutes to soften the skin. Use a disposable nail file to gently remove the surface layer of dead tissue from the wart. Do not file until the area bleeds. Discard the file immediately after each use. Apply a thin layer of petroleum jelly to the healthy skin immediately surrounding the wart to protect it from the acid. Apply the salicylic acid product directly to the wart surface only. Cover with an adhesive bandage. Repeat each night. If the surrounding skin becomes red or irritated, pause for 2 to 3 days before continuing. Consistency is what produces results. Now, the limits of home treatment and when to stop and see a physician. Stop home treatment and consult a dermatologist if the growth is on your face, near your eyes, on the genitals, or in any sensitive area. If any growth bleeds without injury, changes shape or color, develops irregular borders, itches, or appears to be growing rapidly, these are signals that require professional evaluation without delay. If you have diabetes, compromised circulation, or a weakened immune system, do not attempt home treatment. Your healing capacity is reduced and your infection risk is elevated. If you have been consistently treating a wart for 3 months with no visible progress, professional intervention is appropriate. Here is your complete action plan starting today. Step 1. Examine your growths tonight in good light and determine which type you most likely have based on the characteristics I described. Firm and rough on hands or feet suggests a wart. soft, mobile, and hanging from a stalk in skin folds suggests a skin tag. Step 2. If you have skin tags, this week change the first thing in your diet that you can. Choose one source of refined sugar or processed carbohydrate that you consume daily and eliminate it. Not everything at once. One change, repeated consistently. The metabolic shift starts with the first decision. Step 3. If you have warts, purchase a low-concentration salicylic acid product from your pharmacy and begin the nightly protocol described above. Step 4. If you have any growth that does not clearly match the descriptions of either warts or skin tags, if it has multiple colors, irregular edges, or has changed recently, make an appointment with your physician this week. Do not treat it at home. Do not wait. The timeline of what to expect. Within 2 to 4 weeks of beginning salicylic acid treatment, most common warts begin to show visible reduction in size. Within 4 to 8 weeks of the dietary changes for insulin resistance, most people notice their skin tag formation has slowed. Within 3 to 6 months of consistent metabolic intervention, the internal environment that drives skin tag formation changes measurably, reflected both in reduced new growth and in improved energy and metabolic markers. Let me be direct about something that matters here. If you have been removing skin tags for years and watching new ones appear, you are not failing. The method is failing. You have been given a solution that addresses the symptom while the cause continues uninterrupted. The removal is not wrong. The removal alone, without addressing the metabolic environment that is producing the tags, is why the problem returns. Understanding this distinction is the difference between managing an ongoing problem and actually resolving it. The reframe that I want you to carry out of this video is simple. Skin tags are not a dermatology problem. For most people over 50 who develop them in significant numbers, they are a metabolic problem with a dermatological expression. Address the metabolism and the dermatological expression responds. This is not a promise that every skin tag will disappear. It is a statement about where the lever is. And now you know where it is. Margaret was 65 and had been living with what she described as a sense of defeat about her skin for 4 years. She had tried everything she found online. Nothing had worked sustainably. When she came to my practice for an unrelated reason and mentioned the skin tags as an afterthought, she was not expecting anything new. When I explained the insulin resistance connection and suggested a fasting insulin test, she was skeptical. Her test came back significantly elevated. We addressed it. 4 months later, she told me something I have heard many times in different forms. I spent 4 years fighting my skin. I should have been working with my body. She had not had a single new skin tag in the 4 months since the dietary changes began. The ones on her neck were smaller, and for the first time in years, she described her energy as something that actually showed up in the morning. That is what addressing the right problem produces. You are not broken. Your skin was not malfunctioning. It was communicating. It still is. Now you know how to listen. Tell me in the comments, have you been dealing with skin tags, warts, or both? And did you know about the insulin resistance connection before today? Have you ever had your fasting insulin tested as distinct from your fasting glucose? These are 3 different questions, and I am genuinely interested in all 3 answers. I read every comment, and your responses help me understand what gaps exist in what people over 60 are being told at their medical appointments. If today's video gave you something you needed, share it right now with someone who has been trying to remove skin tags for years and keeps getting new ones. Someone who has been using threads or acids without understanding why nothing is working. That conversation might be the one that finally redirects their effort to the right target. I'm Dr. Jake Taylor. Subscribe if you have not already. Take care of yourself, and I will see you in the next video.